Okay, welcome to part 6 of our RBT mock exam review. Today we're going to be doing 51 through 60 and a lot of verbal operant questions. Okay, so I think this is going to be a really helpful one for you guys. So the link to the practice exam is up here. You can also check out our website. I'm going to put the links in the description and the comments below. Okay, so like, subscribe if it's helping. We've got another video coming this week. We put 2 out last week. One is a video with some tips for the exam, which I think is really helpful. It's what I always teach my students when I'm training. Okay, and they found it really helpful. So check that out. Check out the materials. Check out the website, and let's get into it. So 51. Okay, we're going to do a lot of verbal operant behavior today. And as in RBT and when you're training and studying for the RBT exam, you really need to know 4 major verbal behavior operants. Okay, you need to know tact, you need to know interverbal, you need to know manned, and you need to know echoic. Okay, and you really just want to know the definition, right? So 51 asks, another word for request is. So in your verbal operants, okay, which are these 4, what is another word for request? And this might be the most common verbal verbal operant you use as an RBT. Okay, you're going to do a lot of training on this, right? You want to teach your clients to request, right? So you want to teach basic requests like I'm hungry, can I have a snack, can I have something to drink, okay? And then you're going to start teaching them to ask for breaks and things like that, okay? So in ABA, another word for request is a manned, right? So when we talk about manned training, and you should know this from your studying and your training, right? Manned training is just request training. We're teaching them to ask, okay, for things they need and things they want. So when you hear the word manned, just think request, okay? Susie asks for a cup of water. What is she doing? She's manding for water, okay? So should be a pretty straightforward question if you've been studying, right? Just think manned equals request, okay? 52. Every time you say put on your shoes, your daughter says put on your shoes. What type of verbal operant is this? So what's happening in the scenario? You're telling your daughter put on your shoes. How does your daughter respond? She says put on your shoes. What is she doing, right? She's parroting it back, or she's echoing it, right? She's just being an echo. Okay, so if you ask your daughter, what's your name? And your daughter says, what's your name? She's just echoing back to you what you're saying. Okay, so this one should be very easy because it's right in the name, right? So what are our answer choices? Man, echoic, tact, interverbal. Well, if she's echoing back to you, it's going to be echoic. So when you hear people talk about echolalia, okay, this is what they're talking about. Anything you're saying to your client or your student, okay, they're just giving it back to you, right? They're just repeating it back to you. So you could say your ABCs, and they say your ABCs. You say throw away the trash, they say throw away the trash. Okay, so they're echoing back to you exactly what you're saying. Okay, it's echolalia. That's an echoic. 53. Susie's family is driving down the road when they pass by a farm. Susie looks out the window and says, cow. How would you describe Susie saying cow? So for 1 second, don't think about ABA terms. If I were to ask you, how would you describe Susie saying cow? What would you tell me? Okay, what is Susie doing? She sees a cow. She says cow. What is she doing? She's labeling, right? She's just labeling the cow. Okay. You look up in the sky, you see a plane, you say plane. You look in the ocean, you see a dolphin, you say dolphin. Okay. You're labeling these things. In ABA, what is a label? Well, let's look at our answers. Manding. Well, we know manding isn't a label. What is manned? A manned is a request, right? Tacting. Tacting looks good, okay? In ABA, a label is a tact, right? If you're labeling, you're tacting. You'll also do a lot of training on tacting, okay? Because you're going to teach your clients to label things, right? You're going to have them walk around and label, okay? So B is the answer. Let's look at our rest of our answers. C, protesting. No, right? That's not a verbal operant. And D, scripting. No, okay? So quick review. Manned is a request. Echoic is an echo. Okay, you're repeating it back. A label is a tact. Okay, remember that, and you'll never miss these questions. Okay, these should be easy questions, right? So, manned, request, echoic, echo, label, tact. Okay, and you got it. 54, Johnny's teacher says, okay, class, who can tell me what 2 plus 2 is? Johnny responds with 4. What verbal operant does this describe? What is Johnny doing? Is Johnny labeling anything? No. So it's not a tact. Is Johnny making a request? No. Not a mand. Is Johnny echoing back what the teacher said? No. Okay, it's different. What is Johnny doing? Johnny is responding. Okay. What is a response? Okay, to a question, a conversation? That is an interverbal. Okay, interverbals are basic conversation training. If I say 1, 2, and you say 3, or I say ready, set, and you say go, or I say what's your name, you say Johnny, you are engaging in an interverbal, right? It's just a response. Okay. So again, Johnny is not making a request. He's not manding. He's not labeling. He's not tacting. He's not echoing. Not an echoic. What is he doing? He's responding. Therefore, it's an interverbal. Okay. So that's your 4 major ones you need to know. Autoclitic is also an operant, but you don't need to worry about that one for the RBT exam. Worry about those 4. Okay. Make it very simple in yourself, like I just did. Okay. And you're going to be fine. You should nail those questions. Those should be easy questions. Okay. And as we've been studying, a lot of these questions should become easier and easier, right? You can start, hopefully, if you've been watching the videos, seeing how easy the test can actually be if you know your definitions and terms. Okay. All right. 55. Back to measurement. What are you measuring when you take permanent product data? Again, super easy question if you've been studying. What are you measuring, right? What are we measuring when we take permanent product data? Okay. Think about what we know about permanent product data, right? Are we actually observing the behavior happen? No. So how can we measure something that we don't observe? What needs to happen, right? So A, intensity. Well, if you're not observing the behavior, how do you know how intense it was, right? So you could say, well, oh, I came in the room and the room was destroyed. Okay, but maybe the behavior wasn't that intense. They just had a long duration of behavior, right? And they just slowly destroyed the room, but it wasn't that intense, right? So you can't measure intensity without observing it, okay? A is out. B, production. This is always going to be the right answer for permanent product data, right? What does permanent product data do? It produces, okay? What does behavior do? It produces something. When you're measuring permanent product, you're measuring whatever the behavior produces. So the production of the behavior, okay? It's right there in the name, permanent product, permanent production, if you will, okay? You're measuring the production. You don't watch the behavior happen. You're just measuring what happens as a result of the behavior. So whatever the behavior produces. Length of time, again, you're not observing the behavior, so you don't know. D, you aren't measuring anything. No, it's a type of measurement, okay? So you're, of course, measuring something. 56, at the end of session, Ralph's grandma asked how session went and for updates on progress. Which of the following is an inappropriate way to describe the day? So two things here. This is an ethics question, okay? It's asking you to put yourself in the shoes of the RBT being asked a question, okay? And 2, notice how it's asking inappropriate, okay? So be very careful about these questions, okay? If they're asking what isn't the way to do it, they're asking what the not questions, right? They're not asking the right way, they're asking the wrong way, okay? So be very careful and read the question carefully and make sure you're answering it the right way, okay? So we're looking for the inappropriate way to describe Ralph's day. Let's look at A. Ralph only eloped 2 times today. He was compliant and we were able to hit all his targets. A looks pretty good to me, right? I would describe a session that way. Okay, remember, you're talking to his grandma. You want to use very non-technical language, be straightforward, and just kind of tell her what happened. So A looks pretty good. B, I don't think it went well. I don't think my BCBA's plan is working. Hmm. Do you really want to throw your BCBA under the bus like that, right? Remember from last video, what should we always do? Okay. If we're having an issue, we always want to go directly to the BCBA and try to figure it out. Okay. If you don't think the plan is working and you're having problems, okay, you shouldn't be communicating that to your parents, right? Because they can't help you with that. Okay. All that's going to do is make them nervous, okay, and start putting questions in their head, right? If you're having issues, who do you need to go to? You need to go to your BCBA. So if someone asks how session is, you want to try to stay positive and stay objective, okay? If this is actually the case, and it is the right answer, right? This is inappropriate, okay? You need to contact your BCBA or your supervisor immediately. Let's look at the last two questions. Remember, or last two answers. We always want to read all the answers. Session went smoothly today. My BCBA said she implemented a task chain for showering independently in the morning. How is that going? This is a very good way to do it, okay? You're talking about something you're working on, and they're working it at home, and you ask them how it's going, okay? So C is good. D, he is making progress. Today we worked on communication and self-help. Again, straight to the point, exactly what you're doing. Great way to describe session. So 56, the answer is B. 57, during session, your client's mom asks you to train them on DTT. What is the best response? Okay, so for the sake of the argument, let's pretend you've been on this case for a while, okay? And your client's mom says, hey, I want to learn how to do DTT. I want to learn how to do table time, discrete trial training. Okay, what is your best response if the supervisor or BCBA is not there? Remember, what is your role in parent training? Okay, what is your role in assessment, right? Are you the one doing the training and the assessment, or are you assisting? Okay, remember, you're assisting, okay? Your main role as an RBT is implementation, and then you assist, okay, in these other procedures, right? Doesn't mean you're not vital, okay, to the team, but you're assisting, right? So your client asks, hey, can you train me on this? How should you respond? A, inform the parent that you'll let your BCBA know of their desire to be trained, as you are allowed to train by yourself. That's really good, right? It's polite. Okay. Hey, you want to be trained? I can't do it myself. I'm going to tell my BCBA next time they supervise, we'll do some training. Okay. Simple as that, right? So another ethics question on dealing with parents. Okay. That's all you have to do. Let's look at the rest. B, train the parent yourself. No, right? You don't want to train. You can't train yourself. C, explain to the parent that parents aren't allowed to be trained. This is absolutely the wrong answer, right? We do parent training. That's part of our job. Okay. We should be training the parent. C is wrong. D, panic. Never panic, right? Don't panic as an RBT. I know sometimes it can get stressful. Don't worry about it. Don't ever panic. Okay. You don't want to, you want to be the calm one. Okay. You want to be the calm one in all these situations. What do you do if you don't know the answer? What do you do if you're confused? What do you do if you're having an issue? Go to your BCBA, go to your supervisor. Okay. 57 is A. 58, your 21-year-old client smokes cigarettes. Your BCBA decides that smoking is bad for your client and implements a program to decrease smoking without consulting the client first. Is this appropriate? All right, another ethics question. This time an older client, right? We've done a lot of young clients. This is an older one. They're 21. Okay, they're legal. They have consent, right? They have power of consent, all that stuff. Okay. Your BCBA decides that smoking is bad for your client and says, I'm going to take that away. I'm going to decrease smoking, and doesn't ask the client. Okay, doesn't ask them if they're okay with that, right? Is this okay? Okay. Let's look at A. No, the client is not breaking any laws and has the right to be consulted with before decisions are made. This is a great answer, okay? Remember, regardless of their age, if they're able to participate, we want to consult the client, okay? Now, they're not always going to have the end all on say, right? Especially if they're younger, but you still want to talk to them about it, especially this situation where the client isn't doing anything wrong, okay? Maybe smoking is bad for your health, but they're not breaking any laws. You're not doing anything wrong. Okay. So the BCBA doesn't have a right to just sit there and say, well, I think it's unhealthy, I'm going to decrease it. Because what are you doing then, right? Um, you're really not treating them with respect. Okay. Would you ever tell someone without a disability that, hey, I'm going to make you stop smoking? Okay. You might, right? But you don't have the power to just decide that for them, right? And so it's the same with our clients, okay? Just because it's your client and they have a disability, ethically, you don't have just the right, okay, to do just whatever you want, okay? You should be consulting with them, with the caregivers, with the guardians, okay? So, A, no, your BCBA does not have the right, it's not appropriate, okay, to make a change like this without asking them first, okay? Rest of the answers, remember, read all your answer choices. B, yes, smoking is unhealthy. The BCBA is protecting their client. I mean, maybe the BCBA is doing this with the best of intentions, but it still isn't inappropriate, okay? It doesn't give them the right. Okay, so B is out. C, yes, BCBAs are allowed to make changes they want without consulting the client. No, if you make a change, okay, if there's a change in the programming, everybody involved needs to be told, okay? D, no, it is unclear if smoking is unhealthy. No, okay, D is out. So A, 58. 59, Rebecca's BCBA designs a complex behavior plan that involves multiple steps and procedures. During the first session that the behavior plan is implemented, Rebecca reinforces the wrong behavior. What should she do? Okay, so I've been in the situation as a BCBA before where I put something in, the RBT reinforces the wrong behavior, and as a result, new behaviors are formed. What is the right thing to do? Okay, let's say you messed up, right? And now the client is headbanging. Okay, so serious behavior, and it's kind of your fault, right? You just reinforced the wrong behavior. It was an accident. What should you do? Okay, A, pretend it didn't happen. I'm just going to pretend like I didn't do that, right? I don't know why they started. Well, if you pretend it didn't happen and you don't tell me or your BCBA how it started, how can we treat the behavior? Okay. Remember, it's not about you and me, it's about the client. So maybe you made a mistake, but I'm not worried about that. Okay. I'm worried about stopping the client from headbanging or engaging in the maladaptive behavior. And the only way I can do that is with complete information. So pretending it didn't happen, maybe short term protects you. Okay. But long term, it hurts you, it hurts me, and most importantly, it hurts the client. So what A is out. B, she just needs to put it in her notes without telling anyone. You should definitely put it in your notes, okay? But maybe I don't read those notes. Maybe your BCBA doesn't read those notes, okay? And it just lives in the notes. And then 3 weeks from now, I put it in my notes. You didn't read it? Probably not, okay? So unless you're telling me or telling your BCBA about it, okay, it might go unnoticed. So B is out. C, report herself to the parents. No, you don't necessarily need to do that, right? They might not even understand what you did or reinforcement. Okay, so you don't need to tell on yourself to the parents. Who should you tell? Okay, again, the test is going to reiterate this, right? They want you to get in your brain when you have issues or you have questions or anything. Your main point of contact, right? You should be in constant communication with who? Your supervisor slash BCBA. Okay, you reinforce the wrong behavior. We all have text messaging. Immediately text your BCBA. Hey, I made the mistake. Okay. I just want to let you know. Can we do some more training? Hopefully, you've got a good BCBA. Okay, and they're understanding. They come back and they train you. Okay, and you fix the problem. Okay. Don't be scared. Don't be nervous. That is their job. That is your job. Okay. Behaviors happen. It's part of it. Okay. At some point, you're going to reinforce the wrong behavior. Nobody is avoiding that. Okay. And when you do, tell your supervisor, tell your BCBA. 60, which of the following examples would be acceptable in a session note? Okay. So what are session notes, right? It's what you do at the end of every session. You tell about the day. You want to be objective. You want to be complete. Okay. So what would be acceptable in your session note? A, the client was angry with me today, which is why behaviors occurred. What's wrong with that? Okay. What are you doing here? Well, you're assuming the client was angry. Oh, well, he was so mad all day. I could see it on his face, and he was just angry and blah blah blah. What if he was hungry all day? Okay, and he can't communicate, and he doesn't have demanding. Okay, well, you don't know he was angry. So in your session notes, you want to be objective. You could have just said the client engaged in XYZ behaviors. That's fine. But trying to attribute the behavior to being angry, okay, should not be in your session note. B, nothing significant happened today. That would surprise me if nothing happened during your session. Okay, I don't think I've ever had a session where just nothing happened. Okay, so B is kind of lazy, not correct. C, the client became anxious when I told him to grab his cup from the kitchen. Again, how do you know he was anxious? Were you how did you measure anxious? Okay, were you reading his mind and you could see it? Oh, I could see it in his body language. He was anxious. Maybe, okay, maybe we can have that conversation, but in your objective session notes, shouldn't be in there. Okay, the client manded 8 times today independently. Client also tacted spoon and fork. Pretty good, right? Straight to the point, tells me exactly what happened, even uses our wording, manded, okay? So D looks great, objective, clear, straight to the point, exactly how you want your session notes to be, okay? All right, that wraps up part 6, okay? Check out our website, check out the materials right here in the comments below, okay? Like and subscribe if you like it. Plenty of other videos, okay? Keep working hard, okay? For all of those taking the test this week, good luck. Okay, if your test is coming up, keep the questions coming. And as always, just study hard.